So in recent months, contact tracing apps have become a hugely important focus for my research agenda. Here in the UK, we can talk about the long-delayed contact tracing app, which has been positioned by the UK government as instrumental to exiting the ongoing lockdown in England. But beyond whether or not these contact tracing apps work, my research attends to the unforeseen and unintended impacts of these technologies upon already marginalized or overly surveyed communities, and how these big surveillance practices can in fact intensify stigma against communities during public health emergencies. One of the key examples of the concern expressed in my research of surveillance and stigma is the heightened stigma against the LGBTI community in South Korea after contact tracing methods revealed that a renewed outbreak of COVID-19 within the country had occurred in a number of the community's nightclubs in Seoul, and how subsequently the public health measures forced many South Koreans to come out to their families, resulting in distress, discrimination, and in some cases, suicide. Another example that we can talk about when we talk about marginalized communities and heightened surveillance practices and their impacts include also in Guangdong, China recently, where members of the city's African community were forcibly evicted from their homes after it was falsely reported in the media that infection transmissions of COVID had originated in a predominantly African neighborhood of the city. My research then asks, how do we design effective contact tracing strategies which also safeguard the rights and protection of already marginalized, racialized, or overly surveyed communities during pandemics like COVID-19? So first and foremost, community engagement and letting these communities speak for themselves within these contexts is critical. Marginalized communities must be able to express their fears, their reservation, and also willingness to participate in these new surveillance schemes. Following this, policymakers also need to be aware of the unique challenges and dangers of increased surveillance to these communities and how these dangers might increase during highly securitized episodes like pandemics. Cooperation between communities, public health actors, and government must also be ongoing, it must be robust, and it cannot be sidelined during emergencies or recede after the pandemic has subsided. There must also be multi-stakeholder engagement involving experts, activists, government, as well as key community contacts as well. I think it's undeniable that what we will see is the expansion of surveillance networks and new surveillance infrastructures and data collection methods in the wake of the COVID-19 global pandemic. Therefore, as I highlight in my research, there is the need to critically engage with how increased surveillance during outbreaks produce increased stigma against certain communities, highlighted in my research agenda, and that the need to engage with these transformations is absolutely vital now.